All right, folks, we're going to start the meeting. I call this Board of Health meeting to start at 5:30. This meeting is being recorded. If everyone would please rise for the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Just a couple of things I'd like to mention, please. If everyone could make sure their phones are silenced. We are going to reopen our proposed housing regulation public hearing. We are not going to discuss anything that has anything to do with what's not on the agenda. I will not entertain anything about Mr. Hannon. If anyone has any questions, you can call Amanda. You can email Amanda. We would be happy to answer those questions. I'm not going to tolerate the behaviors that we had a month ago. It was completely unacceptable, the cheering, the yelling, the clapping. It's a sensitive topic, I get that, but we can all act like adults, please, and be respectful. So I will entertain a motion.
I make a motion to continue the public hearing at 5:32.
All right, I have a motion, and I second that. All in favor?
Aye.
Aye. Motion passes. 5:32. All right, you want to take over?
So the housing regulations under your next tab. And based on some good feedback from the last meeting of public hearing, this has been drastically cut back. There are no fees. There are no registrations. This will only apply to rental units that have had violations in the last 2 years, 22 and 23. If you go through 24 with no violations, you fall off the list. So it's really only for 1 year if you have any new violations. And that's it. It's down to 2 pages. It's been on the town website since it was edited. It still only applies to non-owner occupied buildings. And
No.
it's as bare bones as it can get.
All right, thank you.
And I do think they were good suggestions, and that's why we went this way.
Yeah, we had some good input. Do you have any?
Not at this time.
All right.
I'm still thinking,
All
but
right,
by all
so
means.
we can open up the discussion if anyone wants to come up. Just please state your name and your address, if anyone wants to come up. I heard some comments, so, okay. Sorry, I thought you were gonna come.
Oh, sorry.
That's
You wanna
okay.
talk?
No, I just, we can't hear.
Oh, yeah, it's hard to hear here in the back.
Oh, sure, I'll try this one then.
Thanks.
What's that?
But your microphone, they want you to turn it up.
It's right there. I don't control the volume.
Oh.
So you can turn it up.
Bring it closer, please, we can't hear.
It's screwed to the table.
Go ahead, sir.
Hi, Mark Marziotti, 50 Lakeview Ave. So I just wanted to confirm, because I did have some difficulty hearing what Mr. Hannon said. So you're saying that the new regulations are predominantly for non-owner occupied rental units that have had past violations only?
Only going back to 2022.
Okay. Great. So if you had a past violation, and not that I've ever had any, but just for clarification, in 2020, then you're not on the list anyway.
So we started using electronic software for housing inspections in 2022. So we have good records from 2022, 2023, and going forward.
Okay.
So that was the most equitable way to do it.
Okay, great. And so I guess my only other comment is thanks for listening to us.
You're welcome. Go ahead, Jen.
If I can just, on that, and we're talking a written violation.
Yes, a
Correct.
written violation.
So if, just to clarify, a lot of times when there's a housing complaint, the agent will reach out sometimes to both parties before an actual written complaint. If that happens and it's rectified, you're not on the list. It's only if you get a written formal complaint that needs action. Just, you sparked that in me. Thank you, Mark.
Correct.
Anyone else? No?
Then you could move to close the public hearing and deliberate.
Should I wait for them, see if they have anything?
Sure.
All right. Hello.
Hello.
We're just now, we opened up the floor to anyone that wanted to come up to speak on the housing regulations. We were just about to close because nobody else had anything before we close. I just wanted to make sure you didn't.
On the last meeting was pretty much what people want. And there's no,
You don't have anything?
nothing.
Okay, all right. So
Thank
then
you.
I answered. Welcome.
Make a motion to adjourn the public hearing.
I have a motion and I second that.
Close the public hearing.
Excuse me, to close it at 6:37.
All right, I have a motion and I second that. So the public hearing for housing regulation is closed at 7:36.
5:37.
Oh, sorry, I'm reading military time. Sorry. Sorry.
And now you'd have to make.
5:36.
You'd have to make a motion to deliberate, if you want to deliberate tonight.
Oh, make a motion that we'll deliberate.
I have a motion and I second that. All in favor? Aye, okay.
Okay. So I do think it's been trimmed down to the bare bones. I think it's a great way that we handle the problem offenders. I truly appreciate everyone at the last meeting giving all the information. That was excellent. That's exactly what we wanted. So I think it's good to go as is. I don't
Yeah,
think.
I don't have anything else I want to add.
Nope. So I'll make a motion to approve the Dudley Board of Health local housing regulation.
I have a motion and I second that. All in favor?
Aye.
Aye, passes. All right. Thank you. All right, moving on.
If I can speak to this before we start on the next item.
Go ahead.
Okay. So the next is the practice of body works regulations. So we were asked, we've been working on this for months. We were asked by the police.
Maybe a year.
Yeah.
Actually, a year.
Okay, so I know it's been a long time. We were asked by the Dudley Police to work on this. Other towns have this regulation, and they asked for us to review and adopt a regulation to help control the body works practices that we did have 2 in town. I don't know if we have 1 or none. I don't think we have any, I'm not sure. But it is something that they have asked us to work on. So that is why I had brought this forward. It was a while ago. So,
All right. We have to open this public hearing.
yep, sorry.
All right. So
I make a motion to open the public hearing on the proposed body works
all
regulation.
right, I have a motion and a second. All in favor?
Aye.
Aye, passes. Oh, at 5:39.
You folks worked on this for a year. I only converted this from the Framingham regulation and changed everything to Dudley. So I'll leave this one up to you folks to talk about.
Right, when we had, if you don't mind.
No,
sorry.
because I think you were in my seat when we
Yeah.
started this, so.
We had 3 different towns, I believe, in front of us at the time, or 2 or 3, and we had felt that Framingham had the best pieces that we were looking for.
Right.
So that's what we had gone over. So I know we had all read through them way
Yes.
back when. And I've read through this several times. At this time, I don't have any questions, but that is where this all stemmed from, was back from some problems and the Dudley Police asking us to. We're the only body that can oversee this, so that was why. So,
Yeah, I also had a chance to look over. I really didn't have anything that I wanted to change or add.
It's pretty
This
standard.
is the Framingham regulation verbatim
But, so I was gonna say, it's
Yeah.
standard.
with Dudley changed.
Okay. Do it up to the public. So we can open this up to the public. If anyone wants to come up to the podium, just state your name and your address, please.
Hi there, Monica Frank Kaufman, 59 Baker Pond Road. So when I was looking at the draft regulations, I thought to myself, do we really actually have any body works places in town? And so I Googled, and so we have Peace Haven, which I went in there yesterday morning, and there was a person in there, so I think they're still in business. And then there was the problematic Body Works place that got shut down. But I was extremely disturbed about the fact that this new Sunshine Spa website is still up, and on Google they are noted to be open. Do you mind if I approach and give you the printouts?
I have seen that.
You have seen that? Okay.
Unfortunately, we have no control over that. The place has been re-rented to a different business.
I know they're not there, but I was wondering if anyone has the authority to tell them to take down the website.
We don't have that authority.
Okay. It just is not a good look for our town. And I would hope we could find some way.
I totally agree with you.
Yeah. Okay. Thank you.
Well, thank you.
Anybody else? Ted? Sorry.
Hi, how are you? Ted Zakowski, 27 Sunset Drive. I know it's not candidates night. Welcome. Anyway, I spoke with Lori Ducharme. Well, I texted with her today. She's out of town. She couldn't be here to talk about the regulation. The only thing, she had two questions. One is the operation that is in business does still, I believe, have curtains closing in the front of their store, so you walk up and you really can't visually see inside. I do believe that's correct. I meant to drive by there and look,
Yes,
but
it is.
I'm assuming that you would be having an inspection immediately following a vote.
I don't recall offhand, I apologize. Is there a time, usually when we pass a new regulation, there's a time frame for the business to conform.
There is, I think it was 30 or 60 days.
Okay.
I apologize, I don't remember offhand.
Yeah.
Open those curtains.
Yep.
The other question she had was just, there's a notation of a hand sink. Is that hand sink for washing of hands okay inside of a bathroom, or like her shop, does it have to be outside, publicly
Yeah.
accessible?
Yeah.
Readily accessible.
So not behind a, half bath or
No.
public bathroom?
No,
Okay.
readily accessible.
All right, that's all. Thanks.
Thank you.
Appreciate it.
All right.
Anybody else?
Is there anyone else? Doesn't appear that way.
Motion to close the
You all
public
set?
hearing.
Okay, I'll make a motion to close the public hearing, 5:43.
I have a motion and a second. All in favor?
Aye.
Aye, passes at 5:43. All right, moving on.
We're gonna
Motion
deliberate.
to deliberate?
Oh, boy.
I'm gonna make a
This is
motion
quick,
I
huh?
make a motion, excuse me, to deliberate on the proposed Body Works regulation public hearing.
A motion and a second. All in favor?
Aye.
Aye, passes. Okay, let's deliberate.
I think it's good. I'm very happy. The police department will be extremely happy. We just want to protect
Yeah.
and not have,
And do you have to change anything in here to change where that sink is? No?
Nope.
Okay.
okay. I'll make a motion to approve the regulations governing the practice of body work.
Okay, I have a motion and a second. All in favor?
Aye.
Passes.
Perfect.
All right. Moving on.
Next item on the
Deliberate.
agenda is a request from SEMA LLC, doing business as Subway. Mr. Patel,
Oh,
want to come up to the table?
oh.
So as you remember, the board had voted not to allow SEMA LLC to operate Subway. Mr. Patel does have the same last name as the prior operator, but it's a very common name in India. In fact, it's the first most popular?
Second most popular.
Second most popular in
in
the whole
Asia.
Mr. Patel came in and met with myself and Amanda and explained the situation. If he were to change his corporation, it would change things with Subway, and Subway wants to charge an exorbitant amount of money to change the LLC. Mr. Patel told us that there was actually a stock transfer. He has bought the stock, all of the stock in SEMA LLC. He has an extensive history with Subway, with other stores. I was actually impressed with how he carried himself and information on his other stores. So I suggested that he came in and spoke to the board and convinced you folks to let him use his SEMA LLC and get the store back open. So I asked him to bring whatever information he could. He brought a package in tonight. You have that in front of you.
Yep.
And the rest is up to you.
All right.
Thank you for all this information. I appreciate
No
it.
problem.
May I ask a question?
Sure you can.
Where, if you don't mind, where have you operated the other subways?
One in Southbridge,
Yep.
one in Methuen, and one in Webster.
Okay. Thank you. Just
You're
curious.
welcome.
And I completely understand what they're saying here, so. And you'll be the manager?
Yeah,
Perfect. And you'll be ServSafe certified, or you
Yeah.
are ServSafe?
Yeah.
Beautiful. And allergen?
yeah,
Will other just curious, will other employees also be ServSafe and allergen trained?
yeah.
Thank you.
And I'll provide the information to Mr. Hannon.
Perfect.
Okay. That's fine.
I don't-
I don't really have any questions. I don't
Okay.
see there's an issue.
So, and your first name is Mayank?
Mayank Patel.
Okay. So, I will make a motion.
Anybody from the public?
Oh, sorry. My apologies.
Anyone from the public have any questions they want to come up for? Doesn't appear that way.
Yeah.
Perfect.
Moving on.
So I will make a motion to allow Mayank Patel to open Dudley Subway under SEMA Subway LLC Corporation.
Okay, I have a motion and I second that. All in favor?
Aye.
Passes.
Thank you so much for the
Thank you very
information.
much.
Welcome to town.
All right, moving on. Standard operating procedures.
Yeah.
Yeah.
Tomorrow morning.
Give me a call tomorrow morning. All right?
Thank you very much, guys.
You're welcome.
Thank you. Have a good night.
So we had had some discussions internally with Amanda, and most boards of health have some standard operating procedures. And I thought that where the board was going to be changing over, that it might be a good time to establish some procedures with possibility of some inexperienced candidate getting the position. And just so there wouldn't be any confusion of how a three-member board works, I thought that this would be helpful.
Mm-hmm.
I did share that with Jen this morning. Amanda had seen it. I don't know if we got a chance to email that to you, Roberta.
I don't think I've seen it.
It's pretty basic. You could read it out loud if you wanted to. After you read it.
What?
You could read it out loud after you read it, so the public could.
Would you like me to?
And I just will I'm just going to add my 2 cents.
Sure.
It's everything that we already do
Mm-hmm.
or have done over the years, so go ahead. Sorry.
Part of this is try to avoid open meeting violations for, somebody making a mistake or things along that line. It's very tough with a three-member board.
Okay. Did you want me to read it out loud?
Sure.
I think the public would.
Y'all want me to read this out loud?
Yes.
Okay. All right, so Dudley Board of Health Standard Operating Procedures. All member communications go through the board's administrative assistant to avoid open meeting violations. All agenda item requests must be submitted to the administrative assistant 2 weeks prior to the next meeting. The chair approves the agenda 1 week before posting. Board members can request information from the administrative assistant by email only. The agent is the department head. Any information requested from the agent will be by email as well. Board members will not have access to the board offices when the office is closed. Board members will not direct the administrative assistant or agent to perform any duties related to the day-to-day operation of the Board of Health. I had something I wanted to add to this. Board members will not investigate complaints and will refer all complaints to the administrative assistant or agent. Board members will refrain from posting any business of the Board of Health related to violations on social media. Board members will not contact the administrative assistant after normal working hours. Board members may contact the agent 24/7 for any emergency on the agent's town cell phone, and board members will be available for emergency meetings with 3 days' notice. May I add something?
Yeah?
So, board members will not have access to the board offices when the office is closed, but we do use the office after hours when we have, like, the bike rodeo or things like that.
Yeah.
So I don't know if we want to change that verbiage a little bit. I don't know if you need to, because that technically is us using it, right? It's not, it is kind of business related. So I don't know, does it matter, or I just wanted to put that out there.
I don't think that's what we're intending.
All right, I just wanted to make that clear. All right. There are times that we
but
go in
let's say what the
there.
intent is, so that
Okay.
it's out there and people aren't suspicious of what that is.
Okay,
There's a lot of confidential information that comes into the Board of Health.
right.
I'll be taking over the Maven reporting. There'll be a fax machine on my desk with confidential information that no one else can see. It's important that no one, comes into the office and sees that and says, gee, we have this serious infectious case in town, I think I need to let somebody know. In my Maven training, confidentiality is the biggest thing of all of it. So that's the sole purpose for that.
Okay.
If we're having an event and we need bicycle helmets and things like that, that's not a problem.
All right. I'm fine with these. I know it's what we're already doing.
Right.
And in most towns, the chair does have access to the administrative office. So the fax machine's not in the administrator's office, so I don't see any problem. The chair should have access to town hall and have access to the information.
Is this something we're voting on?
We will have to.
All right, do you want, does anyone in the public have any comments? Want to come up with any questions? No? No? All right.
Make a motion for the Board of Health to accept the standard operating procedures and put them into activation.
I have a motion and I second that. All in favor?
Aye.
Aye, passes. Okay, moving on. Intermunicipal agreement.
Yep. So,
You want to chat?
well, you folks signed this. And this was an intermunicipal agreement for regional inspectors and regional assistants for the Board of Health. And having taken over after the town not having a health agent for over a year, but relying on our intermunicipal agreement, a lot of things went by the wayside. And I think that a lot of mistakes were made. You can speak to the nursing part, and you can speak to the other stuff, but
Yep.
it's been problematic.
Right, yeah, I mean, during the peak of the pandemic, it was okay, but once we shifted gears, there were a lot of things that were not reported to us and things, it just, I felt like we were left
Out.
out, yeah.
Yes,
Yeah.
yes. Yep. And I don't like the idea of, we now have a full-time agent who's supposed to oversee everything, and I don't like the idea that the regional inspector wants to just come in and do this and this and this and not communicate.
Mm-hmm.
Or at least that's the impression I'm under, that I've been receiving.
Or
is
in
that-
some cases, we haven't even known they were in town doing an inspection.
Correct. There's been limited communication, so I would like to, that's a problem to me.
My biggest problem was housing inspections, and we've had some, unfortunately, a lot of our veterans live in rental apartments in town. Some of them are substandard. There have been inspections of some of these veterans' apartments. One of them was being evicted. The fellows are disabled, bedridden, They had complained that the ceiling height in their basement apartment was only 6 feet. The code requires 7 feet for it to be habitable, and the regional inspector raised the ceiling height to 7 feet in a basement apartment. So you're either gonna dig a hole for down
Right.
or jack the house out. It just wasn't realistic, it was ridiculous. I was able to go in and negotiate with the landlord to not evict the people. They were willing to accept the 6-foot ceiling height. They had accepted it for a long time, but there were other things wrong. So he agreed to fix those things in exchange for them accepting the 6-foot ceiling. I spoke with the veterans agent. He couldn't find them any housing. He couldn't find them anywhere to go. They were going to be homeless. And that's what touched that off for me, was a
Right.
ridiculous raise the ceiling to 7 feet.
I mean, this definitely was a great agreement when we needed it,
And
to have that, to have those folks out there to help us when we needed it, but I think now, it hasn't really,
I think it was,
hasn't benefited us much.
it wasn't what I thought it was going to be either.
Same.
That just, I thought we were gonna have more outreach in our town from the outreach coordinator and the nursing and things like that.
Yeah.
I guess they had come to a meeting, they were gonna, and we never saw anything, so I don't know what the benefit is.
Right.
The only thing that we did, if I'm correct, we did get the software
Oh,
through them,
right,
is that
yes.
correct?
Yeah, I believe so.
Or do we pay for the software?
We do not pay for it
We
right
do
now,
not
but
pay
it
for the
is in our
software?
budget.
Okay,
So we
but
can
the
pay.
software, that's what I thought. We had
Yep.
put it in because it was originally done through a grant, if I'm not mistaken, through that. Am I correct?
Yes, but it was being used also by the regional inspectors, and the software really doesn't work properly.
Okay.
It won't let you do an inspection and close it out unless you find a violation. So if you go do a housing inspection, and there's no violations, it tells you, you have to place a violation to close this report. And I've been complaining about that since the first day I came here, and all I've gotten is, we can train you how to use the software.
Some bugs in there that need to be fixed.
I found the workarounds, but it doesn't work as it's supposed to work.
Yeah.
We'd be better off getting our own software or going back to paper.
Okay.
I will say I do like the electronic because it creates,
It gives a great report.
Right.
You can take pictures and it's in the report. Other towns that use inspection software, they put every inspection on their Board of Health's webpage.
Love that.
And any resident in town can go on and say,
I would love that.
you know, what happened to Bob's Pizza today on that inspection? You can read the inspection, you
It's
can
all
see the
public
pictures.
information,
It's all
Right.
public
so
information.
I would.
I like it
absolutely-
myself.
I would absolutely love that.
Yes. So-
Everything, just because it's public information, that is all public.
And I think people want to know.
Yeah, and they have the right. All right, that being said, so we have to either, we need to stay in it or
Or
vote
get
to
out.
stay in or
Leave.
vote to stay out.
And you're up on the time to vote to stay in or vote to stay out.
Right, because I did see.
Is it due?
I saw the email from Connor.
Okay.
Regarding another town.
And as you can see, because of what's happening with our newcomers, all of the health budgets are getting cut, all of the regional budgets are being cut, the opioid budget was cut.
Yeah.
All of things, it won't be long before our honor again anyways, but we're still part of this intermunicipal agreement that really doesn't do anything for us. And I followed your lead and the chair's lead on, you know, why are we doing this?
Right.
So,
All right,
Wanna-
I'll make a motion to
Right.
not renew the IMA with the regional inspectors.
All right, I have a motion and I second that. All in favor?
Aye.
Aye, passes. All right, animal inspector.
okay.
All right.
So, as you know, the selectmen appoint the animal inspector. I sat at that meeting for 3 hours, and I listened to some concern. And I think there's some misconceptions of what the animal inspector actually does. But quite frankly, I'm not interested in being the animal inspector. I'd like the selectmen to find a candidate that they want to appoint. There's a stipend for being the animal inspector,
Yep. It's,
and I would just prefer to push it back to the selectmen.
I have no problem with that. Just to give a background on the animal inspector, In all the years past, it's always been the ACO, animal inspector. They've taken both positions. It's overseen by the Board of Health, has been for at least 15 years that I know of. It's mandated that the Board of Health pay $3,000 a year for an animal inspector. That's the mandate that we have to pay. That was put into effect probably about 7 or 8 years ago, that we had to pay $3,000. What the animal inspector does for the Board of Health is it goes out and it does all the registered barn inspections. And it's not a deep inspection, and they report directly to the state. All we get is the copy of the booklet
Right.
of all the inspections. Everything goes directly to the state deals with it. It's just, the Board of Health has always overseen it. And I have no problem, we can send,
Oh,
send
yeah,
something.
let them do it.
Yep, let them, that's how it's always, and I understand now it's the police is the ACO.
Yep.
And the animal inspector also is responsible for quarantining dogs.
Quarantining, euthanization,
Yep, all dog bite cases go.
cutting
dog-
heads off of animals and sending them to Mass DPH for rabies testing.
Yep, that's,
No, thank you.
and the, all dog bites come directly in to Amanda.
And we did have a dog bite last week that was serious, and the woman was upset that there was no animal inspector, but there hasn't been one for some time.
Correct, and we've made mention to them that it's required that they need to have, that they're quite aware of that,
Yeah.
that they need to have one. They've gotten notified by the,
Do you guys have something that you want to share with us? Thank you.
Somebody has.
I'm sorry, I didn't mean to cut you off.
no, I think you have someone.
Come on up. Nonsense.
Hello.
Hi.
So my name is Katie Rosina Hansen, and this is Victor Calgren. We're here as representative of the Dudley Agricultural Advisory Commission. Just wanted to make sure that we've talked a little bit with some of the selectmen about the animal inspector, and it's great to hear Mrs. Canoyer a little bit more about it. But just wanted to offer up any expertise or help that we can provide from the agricultural point of view. We want to just make sure that whoever does end up getting appointed or hired is actually qualified to do it. And
So
That would go
being
to the-
said- Well, that being said, when you become appointed, you have to go through training.
okay,
It's required by the state, and the state authorizes that you've completed your training. See, we oversee it, but we have very little control over it. It's all done through the state, and that's one of the things Patrick had started some of the training.
So I did the dangerous dog training, and I just want to say, I was taking one for the team by agreeing to be the animal inspector, and I'm more than glad to not be the animal inspector.
I don't blame, there is a lot to it, and we definitely want someone who is, you should be familiar with working with animals and know certain things, absolutely. And that's why I think it's great that the state has they have to go through training. So if it's my understanding correctly, the selectmen can appoint someone, it goes to the state will see what the training has been and make sure that this person goes through the necessary training, and the state ultimately says, you're a go.
perfect.
They'll send a letter saying that you're the approved animal
Right.
inspector. Yeah.
Okay, we were a little bit fuzzy on, we weren't sure, we saw animal inspector, we were thinking barns, we support the farms here in the town, so just wanted to get a little bit more clarification, because we weren't exactly sure how it, what the process was, and wanting to make sure that you have somebody who knows, not just dogs and cats and that, but also if you're walking into a barn full of cows or horses, pigs, chickens, whatever it may be, that they're at least comfortable with that. And when you say the state, is that DPH or is that MDR?
I believe it's Mass Department of Agriculture.
It is
I put the
MDR.
regulation right in your
Maybe
book.
if I look like.
That's okay.
It is.
I was just curious. Because I know that the state has animal inspectors
That's
that go
Department of
out.
Agricultural Resources.
It is?
Yeah.
Okay, so it's MDR who says, yep,
Oversees, yep.
you're good to go. Okay, and do you have a contact at MDR? Do you know who actually does that? No?
It's on their website.
Yeah, I don't know.
So just for information, I emailed that person when I was hired in December, never got a response.
Oh,
So
no, that's
a
not
lot of them are still working
Look
remote.
at me like that. It's not my job. Okay, well, we can always follow up if we need it, not in my role here at the commission, but in my role as a private citizen who works for MDR.
The major part of this job is though rabies control.
Okay.
That is the main focus of it for, dog fights, bats, things like that. That's the main focus. The barn inspection is about that much of it.
Yeah, well, we figured as much because there's not like it's,
And it's only done
That
once
many
a year.
barns.
It's done once a
Yeah.
year.
Yeah.
And so just because of past history that has gone on, there was a situation where an animal inspector was not completing them properly, and the state contacted us to have them removed as animal inspector. So at least, that makes me feel good, at least the state is looking at
There's
these
little
things.
oversight,
that
additional
they fill out.
oversight,
It's not
yeah.
just, here you go, so there is, they weren't happy with what was being done. And again, I don't look at the reports. All I've known is that this is my completed booklet, here's your copies, this is what I'm sending to the state. They would let us know.
okay.
So.
Okay, no, that's super helpful. We weren't 100% sure what the process was, but just wanted to make sure, like, if there is any input that we can provide, we're happy to do so.
Absolutely.
Do you have anything else?
So I believe the process is that you would come to our committee for advice in making the selection.
We have nothing to do with that.
That's the
Selectmen.
The selectmen are the ones who
Yeah.
appoint the animal inspector. We don't recommend, we don't anything. The reason why Mr. Hannon,
So who
Patrick,
picks the person?
the selectmen are the ones who
Selectmen.
appoint.
After you recommend someone?
No.
No.
The only reason why Mr. Hannon was being appointed
Yeah.
is it was when the job description was revised for a full-time agent, it was put in that the full-time agent would be the animal inspector, which is uncommon, but they were trying to streamline some things and everything, but I don't necessarily think it's the best way to go.
So then technically the selectmen would come to us for that.
What I would suggest to you guys is if you have someone in mind or know of someone who's looking to do thankless
Contact them.
jobs
Give
for
them-
about
contact them.
$3,000 a year, that's what the Board of Health pays you a monthly stipend.
Gotcha.
And that's what they would be doing.
Well, basically, our advice as a committee would be, what is the job description and what other qualifications? Are they state?
The state doesn't require any qualifications.
Okay, so you don't have to be from Dudley, you don't have to, any of that. You could just be
So
the animal inspector in Charlton and just be like, yes, I will do Dudley too, why not? Okay,
Correct.
okay, so there's nothing that's set back, it's the selectmen, they bumped it to you for
Right,
that.
and we happen to oversee it, we have, and we pay it.
Okay,
Because they feel that it does fall under that Board of Health.
thank you so much.
And I think it's because of the dog bite aspect that we oversee it, because that's, the animal inspection, the barn inspections are important, but they can be done on a scheduled time. It's the dog bites that are, and I would say lately, there's been a lot of dog bites. A lot more than, and that's the biggest concern, because you have to work with the ACO.
Yep.
Who happens to be Officer Pacheco from the police department. So once he gets that, then he notifies us, we get the documentation, or we get notified of a dog bite from a hospital or something, because they didn't call the ACO at the time.
Yep.
So that is the most complex and probably the most intricate and
Gotcha, so it's mainly rabies, dogs,
Yep.
that kind of stuff, as opposed to more barn inspections going onto farms, things
basically
like that.
you're looking to make sure that there's a shelter,
Yep,
water, food, that they're not living in filth and squalor, and you know what I mean?
or a cupboard?
Correct, that it's
I get that.
it's a good, but they're not, never have they gone out there, picking apart anything.
Gotcha.
That's, and if they see something, they're Their job is to contact
The state.
Yep.
Okay. Okay.
So our advice would be just what we feel Dudley needs.
Right.
Like, one thing here, you don't have to have a degree. You just have knowledge of animals. We would require much more than that. So in other words,
between them.
the animal inspector
Yeah.
even has to know about not spreading from one farm to the other. If you find something, guess what? If you don't have boots on and you don't disinfect, you're not coming to my farm. So it'd be stuff like that that we in Dudley might not be on here.
Right.
And I was looking at qualifications of previous inspectors.
Yeah.
And, you know, she had a 2-year degree in agriculture. She had
She was perfect.
animal,
Who's that, Jen?
you know, the ones that help the vets.
Yeah, she was an
A
animal
vet
tech. Yeah, she was a vet tech.
So those are things that we would say, oh, that's great, you know?
I 100% agree.
So that's our main project.
So what I would, I definitely, and I encourage you to reach out to the Board of Selectmen, tell them that, you know, this is, and I wholeheartedly agreed.
Oh, yeah,
Jen was
you're-
a great
yeah, she was
animal
great.
inspector because she had the knowledge. She had horses. She grew up around everything. She was in the field, you know, she had a knowledge. She doesn't have to have top high-end knowledge, but she had a knowledge.
A lot of people have knowledge of animals.
Correct, you know what I mean? So I would, you know, at your next meeting, you know, come up with something.
Yep.
And submit it to the selectmen.
Yes.
Absolutely.
Approach them.
And we do, it is a $3,000 stipend.
Thank you. So my farm is a closed farm.
Right.
In other words, I don't buy in animals ever, you know? So, you know, over 50 years, the animals that have been there are there. So I really am concerned with people when they come.
Absolutely.
And so there'd be places that I would ask the inspector, no, don't go there. That's a feed alley. And it's just stuff that we know, you know? So-
And that's what I think the goal is you're more educated about your farm than anybody stepping on your property. So the goal is to have that open communication and to work together, because by no means would we want somebody to harm anything in town. We, you know,
I mean, in the past, she had come and said, oh, I'm not gonna walk all over everything. I see you have water, you have shelter.
Exactly.
And how many did you have? I told her, and that was it.
that's right, it's a very invasive, you know, and I think it comes off as it's gonna be this huge inspection and da-da-da-da, but it's a very invasive, and it's more, I think the state just wants to keep tabs on what's going on, and, you know.
A lot of people don't realize, I'm sorry for taking so much time, but
That's
a lot of
okay.
people don't realize, you know, they go by my farm and your cows are out in this blizzard. But I said, look at her, she's chewing her cud. A cow does not chew her cud unless she's happy.
That's right.
She's not happy in this weather. Tomorrow, they're not going to be happy. They're going to be
Oh, no.
looking for shade. But don't be concerned if you see an animal out there that doesn't necessarily have shelter, maybe a windbreak or a tree to go under, you know?
Correct. And that exactly is.
Appreciate your time.
No,
No,
thank you.
Thank you. We
Yep.
appreciate your
Yes,
input.
thank you, thank you. It's
Can we-
great to hear a little bit
Can we
more.
keep it?
Yes.
Do you want the
Yes.
Yeah, and if
secretary?
you need anything else from us, just reach out.
Okay,
You know.
great. We'll just stay tuned, and once we hear from the selectmen and all of that, we'll just stay tuned with who it ends up being and just try to have communications with them if there's anything else that they need.
Please do it sooner than later, because we're still getting the dog bite phone calls and having to tell the public there's no animal inspector, and they get
Gotcha.
very upset.
Yeah.
Gotcha. Our meeting's in the next 2 weeks, so
Perfect.
we will have something
Thank you
prepared.
so much.
Thank you.
All right, so next up, bike rodeo. So
Can I
it's,
still ask a question about the inspector position?
sure.
Hi. I had a quick question. You had mentioned.
Just got to
like,
state your name, please, and your
Sorry.
address.
Anna Durgan.
You can sit or stand wherever you want.
Anna Durgan, I live at 68 Eagle Drive.
Yep.
So I was just curious about the dog inspector. You had said something about rabies testing and decapitating and sending it to the state lab. Is that correct? Is that part of the job description?
We have in the past, they have had bats that would be caught at a barn or something, and they would have to send it for rabies testing. I
Do
do
you
know that-
work with a veterinarian that
His-
does it humanely?
It
or?
was just online information of what the inspector does.
But I know that Jen has in the past.
Yeah, and that's just not something that I was up to do,
I-
so.
No, I'm just.
I believe she and don't quote me, I can look back in the records, but I know Jen had it, I can picture the barn where it happened. I know she had to take and I thought she went to Tufts, because I think something for the
You
municipalities.
have to send it somewhere.
Yeah, I think,
Yeah, you send
I
it
think
to the
was
state
Tufts.
labs. Yeah,
I
you
dealt with
do,
it.
but it's.
I could be wrong, but for some reason.
Yeah, that's why I was just curious, because you had mentioned that, so I wanted to make sure that it's
Yeah.
done properly
yeah.
and humanely and not, you know what I mean?
Oh,
in
no,
the
she
proper
caught the bat,
setting.
and I believe it was Tufts she brought it out to. I know it was.
So it's not, you're not physically doing it,
Okay,
you're, okay, because the way he said it, I was like.
Maybe he just misspoke, that's all.
Yeah,
and we
that's
don't.
why I'm clarifying, because
Yeah,
I wanted
thank
to know
you.
for my own information that it
Yeah.
is done humanly.
absolutely.
and
Yep.
Okay, thank you.
Okay.
Bike rodeo.
Bike rodeo. All right, so we have bike rodeo planned for June 27th,
Yep.
and we are going to have it here
Yep.
at Town Hall. We still have to get permission.
Oh.
Yeah, so it's a tentative date, I should say, for June 27th. June 3rd, I think, is the next meeting.
Yeah, it shouldn't, I
They usually
don't-
say yes every year,
I don't
but,
foresee a problem.
Yeah.
But Amanda, could you send?
You guys are on the agenda for
yeah,
June.
yep,
Beautiful.
yeah. So that's where we are right now before we can advertise, and hopefully this year we could get more than 50. That was our goal.
We got 49 last year.
I know. So we-
The Grange has also offered, last year, we had a table at the
Strawberry
Grange-
Festival?
Yeah, the Strawberry Festival, and we were handing out reminders
Yep.
about the bike rodeo.
Yep.
And I think that definitely helped the situation.
The reminders.
Yes.
Yeah. So as soon as we have the approval, which is in a week or so, right, June 3rd, couple weeks, then we can start posting.
Yep.
We'll put it out to the school again.
Yeah,
All right.
beautiful.
Earth Day. So we just want to go recap. We had Earth Day. The weather was not pleasant, so we had to cancel our second part, which was the first time we did that this year, where we wanted to have festivities here at Town Hall, like a family day. What we're going to do bike contests and water chalk drawings and pizza contests. So
Bounce house.
yeah, so we had to cancel that, unfortunately, but we still had the Earth Day part of it. I don't know how much trash we collected.
2,450 pounds.
Wow, all right.
That was a lot of trash.
We had our same groups coming out down at the
Yep.
highway barn to get their stuff. It's the same groups we see every year. We did see a couple, which was very nice, some more young adults and from NJHS and
Yep.
NHS that came by to pick up trash. They did an amazing job.
What's his name? Damien.
I want to thank
Damien?
Damien.
Damien Dittmeyer from D&D Disposal.
Yep, he was great. He
Yep.
went around and picked up all the trash for us. Anytime we said there was trash left, and he even did it days after the
He did.
fact. Because it is difficult. Some people can't get the bags till that morning. And it is difficult to get it all picked up, especially when you have kids and you run into
Yeah.
different events and stuff. But they called the office. We told him just call the office because he said he'd go around and pick it up. He went around and picked it all up. It was,
And he disposed of it at his cost.
Yep.
He made that donation to the Board of Health.
he was wonderful. We appreciate that very much. He wonderful to work with.
He is a local Dudley hometown guy,
Yep.
so
Yep, Gentex came out. That was great. They had a great team.
Yes, they
Yep.
did. But we thank everyone who came out. It was great. We just hope that every year more and more people get involved,
Won't rain.
and it won't rain.
I know.
And it was chilly.
It was chilly. Yeah.
I have to mention that Damien got so excited about it, he actually offered to do it every month.
I know.
It's too much.
So,
Calm down a little bit right now.
Right, right.
Give us a chance. I know he had a great time. He was there the whole time. He was great.
he did make a donation, and you folks need to vote to accept that donation.
Oh, entertain a motion.
I'll make a motion to accept the
It's $200
cash
donation.
donation of $200 from Damien Dittmar to be used for the Board of Health activities.
All right, I have a motion, and I second. All in favor?
Aye.
All right, passes. Thank you.
Yes, thank you very much. It was very surprising
Yep.
with everything else he had done for us.
Yeah.
He brought
Yes.
donuts. we had
Yeah.
our water and granola bars and all the usual stuff, but he came back with donuts, was giving the kids,
Yeah,
you know,
he was
he
good.
was,
Yeah, he was
it
good.
was great.
Yeah.
So, even though it rained, it was still a good Earth Day.
Yeah, yeah,
Had visits from a few other people in town.
yeah. All right, so update on ticks and mosquitoes. So it's that time of year where it's raining, so we just ask people to be mindful of standing water, tires. I know bird baths are standing water and they're pretty, but just to make sure you pay attention to the standing water. We do have some brochures in the lobby on ticks, and is the other one mosquitoes? Or is, yep. And then there's also, we'll leave some of these downstairs too. One is protection on mosquitoes. It's like a pocket thing, and the other side is ticks, and then a tick ID card. We usually pass these out at the bike rodeo too, but we have some that we'll share. We'll put those in the lobby as well, just to make people mindful that is that time of year. If you're in the woods, pay attention, do some body checks, check your animals especially. I found one on my cat. Yeah,
know,
so
they're out there.
Yep. Anything else that you want to add to that?
No, just,
right.
The standing water, I
Yeah.
agree with you.
Yep.
You know.
Good. All right. So the next is food service inspections and retail food.
Everything's, since the subway closure and since all the deep inspections of all of our restaurants, we have not had any foodborne illnesses. We have not had any issues. I've gone in and done follow-up inspections, and everybody's doing a great job.
Mm-hmm. Great. Great. Anything you want to add?
No, I think
All
it's
right.
great. It's nice to know that the restaurants are all safe and doing what they should be doing and appreciative.
Right. So this is our last meeting, huh?
Yeah.
Miss Jennifer is done. This is her last meeting with us. It's been a long 15 years, has it been?
15 years, yes.
9 with me, so it's been entertaining.
Yes,
We've
it
seen
has.
quite a bit.
Yes, been
Who would have
through.
known we went through a pandemic? But it's definitely, I've learned a lot from you. Thank you.
Thank you.
I won't say I'll miss you because I know where you live and I know where to find you.
That's right.
But we will definitely miss you.
I appreciate it. Thank
Yeah,
you.
Thank you.
Yep, 15 years ago, I was told there was nobody running for the Board of Health. I was told, oh, you know what, run as a write-in, it'll be fun. And it has been.
Yeah.
It really has been. I've learned so much. I thought I knew some stuff about the Board of Health, having been around the industry and things in my life, but I learned a lot.
Yeah, we learn a lot every day, don't we?
Yeah. I truly have enjoyed the privilege of serving the town for these past 15 years. It was a very difficult decision this year for me to make. My father's had health issues, which you know. I need to be there for my mom, my family. I'm the only one there for them. So, and it just was taking time away from this. I couldn't devote the time that I need to for this because, as you know, there's a lot of reading and pre-stuff that you have to do. It's not just one meeting a month. It's so much more than that because we have so many ongoing things, so many things behind the scenes that you get notified about and you need to read up on, and it's a volunteer position. Just in case there's any misunderstandings, this is completely volunteer. We do not get paid anything to do this position. As a matter of fact, at most of the events, we're putting our own money in to purchase the things that we need because our budget is non-existent, basically, for anything extra. You know, the bike rodeo, if we have pizza there, it's because we've purchased it. If we had, during the COVID, all the COVID flu clinics and everything, all the fruits and juice and everything we had for the people getting their COVID shots, that was all purchased out of our pockets. You know, we do it because we enjoy it, not ever because we're looking for, look at us. That's definitely not why. It's not why I've been doing it all this time. COVID was a whole different event. It changed the way the Board of Health was. I truly think we spent more time in this room during COVID
Oh, yeah.
than I spent at home.
Yeah.
During COVID, it was 7 days a week, 24 hours a day. It was the weekend, didn't matter.
Nope.
Somebody was calling about something and deciding, how are we gonna keep the town hall open? How are you gonna keep people safe? How are you gonna do this? How are you gonna how are we gonna have an election?
Oh my gosh, I know.
We had the presidential election during COVID. What precautions do we need to take? How do we do this so everybody's safe and people feel safe? And
Right.
how do we not go overboard like some places wanted you to go? And it was a trying time. We met a lot of different people
Yep.
during that time.
Mm-hmm.
I would say that I left working through COVID having great friendships. Met a lot of good people, learned a lot. So during the course, I learned about more than I probably ever wanted to know. Septic systems, I know a lot about them now. Restaurants, food inspections, went out on many food inspections, saw things that I prefer to forget. But it's part of it, and so you learn. You learn what really goes on. Makes eating out a whole different process once you've been behind the scenes and see everything. Learned a lot about housing. If you think you have a messy house, don't worry, somebody out there's got a worse one. It's all good. Learned a lot about cemeteries, much more than I ever cared to during some things. That was interesting. I know that I'm gonna miss this in the beginning. I know there'll be a void.
Yeah. Will
but
you show up on Tuesday?
No, I'm sure I'm
Okay.
going to find something better to do on my Tuesday nights. Don't you worry. I also do feel that it is the right time because I feel that for so long, we fought to get a full-time agent.
Yep.
And now we finally have a full-time agent so that when you're chair and you don't have an agent, everything comes to you. So you're reaching out to all these people trying to figure out, how are we going to do this? Who are you going to do this with? Who's going to help me? So I feel that things are in great hands. You're doing an amazing job. You've been chair for the year, regretfully.
Yes,
But thankfully, I appreciate
You're
it,
welcome.
and you've done a great job. I thank everybody who supported me over the years, who went out of their way to help me when I was running. I also want to just thank the Charlton Health Director and his office, because during COVID, when we were left without an agent,
Yeah, he helped us.
he stepped up like that.
Yep.
I called him and I'm like, I knew him through the Board of Health because we had met with Charlton Board of Health, so I had met him. I called him and I was like, Jim, we need help. He was here. When we were dealing with the schools, he was here. I think we would have been lost without him for a while, and I appreciate him very much and I respect him.
Yeah.
But, so I've thoroughly enjoyed my time serving. I've always tried to put what was best for the town out there. That's first and foremost, we always thought about the town and the people and how can we make it best for them. Just thank you, and I will miss it. But I'm sure I'll still hear bits and pieces of it. And you guys would do great. And
Yeah.
everything's heading in the right direction. We've done so much
We have.
progress.
Mm-hmm.
We've improved Earth Day.
We've seen the dips and the
Yep.
valleys.
So I thank you
You're welcome. Thank
very
you.
much. Thank you.
So are you going to do your last
My
motion?
last motion.
Oh my God.
I know. I make a motion to adjourn.
I have a motion and I second that. All in favor?
Aye.
All right, meeting adjourned at 6:30.
Thank
That's
you.
what.